Hi, we are Homedika and we want to become a new culture, home and style of Indonesian healthcare by utilizing our innovative technology to connect health professionals and community in need with a variety of healthcare services and facilities at home. So let me tell you about the problem that we are addressing. Hani, a 51-year-old woman living far from the city should live in a poverty line in a very small house, with breast cancer become the major problem she is suffering from. Every day, she shouldn't be able to go to the hospital to get medical services because of the unaffordable health costs. At the same time, she truly needs to recover her health condition at home with qualified healthcare services. Once she went to a hospital, this was the condition. She must stand in line and waiting so long just to get medical checkup. This has also happened in other patients in the hospital. The long process and lack of qualified health services somehow also lead them to experience bad results just like malpractice which can possibly threaten their lives. On the other hand, once they are suggested to be hospitalized, these are the bad condition again. The facilities still need to be improved as it is essential for creating a comfortable environment for the patients. In, in addition, the lack number of health facilities in fact has been a burden for some patients to get proper medical care from the experts. Ladies and gentlemen, this is just a slight view of health problems happen in Indonesia. Indonesian healthcare system is on alert. Recognized as one of the most populated countries in the world, Indonesia has encountered endless health system problems for more than a decade. The greater part of the Indonesian population generally has very limited financial resources and therefore cannot afford health access. At the same time, Indonesia's healthcare system is rated as one of the poorest of any Asian country with sparse and low quality services. Households only spend about 2.1% of their total consumption on health. Besides, the financial resources another main factor contributes greatly to this healthcare access is about the figure of medical health workers per population. The WHO reports shows that the health workers in Indonesia mostly have low productivity, and it is added with the lack of health facilities, only 0.6 beds per 1,000 population. It is also added by a new information that most of Indonesians prefer to go to the hospital by motorcycle and by on foot, where it takes 16 to 30 minutes, so it's not really effective. So is there any current solution to tackle these issues? The answer is yes, but most of them appear differently. They're costly, only less services and therefore less choices, and it's not really accessible for the rural community and therefore there is no chance for the underprivileged people. So how do we come up with a new solution that is more affordable and there is more healthcare services and it is accessible for rural community? And it might be possibly to have crowdfunding system for the underprivileged. The answer is Homedika. It is a technology-based social enterprise that connects health professionals and health facilities to the community to provide a variety of health services at home. Our vision is we want to make Indonesian healthcare integrative, connective, and collaborative. In 2018, we want to connect for more than 50,000 health professionals to join with us. How does it work? Both of health professionals and the communities or they would like to become our patients, they normally or technically just register and then they can log in and then they get the confirmation. Once they get the verification from our customer service, they can use our service and they just can order through our website at www.homedica.com. We have 10 types of health professional with more than 90 healthcare services and 5 types of health facilities including ambulance, drugstores, laboratories, crowdfunding platform, clinics, and online store for medical equipment. We commit to make people feel the benefit of the easy and complete services and facilities that we provide, thus they don't need to be worried again. It is a technology-based social enterprise that connects health professionals and health facilities to the community to provide a variety of health services at home. As you can see, this is our business model canvas. How to achieve our market? We will work with only skilled and experienced health professional and try to understand the general patient's needs, adapting the healthcare services to the patient needs and living environment, giving online reports, providing health great customer services, and always hold our main values, which are focusing on fast and best quality healthcare services. So how to reach them? Our channel is we will use social media tools in order to build brand awareness and education to target customers as well as to the public in general. In order to get the retention and engagement from our customer service also conduct regular follow-up activities in order to make sure the operations run well. Founded in June 2016, we have collected feedback from our respondents as much as 81 respondents. With on the whole, 80.2% are interested to Homedika, 94% have internet access, and 90% needs home care services. This is also has been validated by legal aspect, academicians, practitioners, House of Representative members, and Department of Health Malang City. With the average sale cost per unit 1,000 rupiahs or about $8 with monthly service target per city is 500 units, you can see that the BEP will be achieved after 12 months period. In 5 years later, with for at least 95 cities times 500 units per month, we will achieve revenue in the amount of 5.7 billion rupiahs or around 200,000 US dollars. In general, from the total transaction, 80% is given to health professionals and 20% for the company. So what's next? We have 10 types of health professional with more than 90 healthcare services and 5 types of health facilities including ambulance, drugstores, laboratories, crowdfunding platform, clinics, and online store for medical equipment. We commit to make people feel the benefit of the easy and complete services and facilities that we provide, thus they don't need to be worried again. This is the mobile app and this is the Homedika store. This is our portfolio, and last but not least, thank you.